Hi, you are watching COVID Update and this is Sana Haroon. With the US border now open to non-essential travel for fully vaccinated individuals, people can hop across for a one-day trip or longer if they choose.
The tests are only good for 72 hours, so if you're going somewhere for longer than that, you're going to need to get tested in the US.
Exposure notes.
Regardless, it has to be a molecular PCR test to get back into Canada. Mine takes about 20 minutes and sets me back $169. But shop around. We find prices can be as high as $300 and some can take up to a day for results. Negative test? Check. Federal vaccine passport? Check. But the US border official only asks if I'm fully vaccinated, but doesn't ask for proof. However, others might. After about 5 minutes, I'm en route to Grand Forks, where no Manitoba plates are immediately visible. But the city council president is hoping to see a rush. Although the city is trying to help Canadians meet testing requirements, the site offering free tests can take up to 72 hours for results. The ones with faster turnaround times, of course, cost money. I'm about to show my negative test to get back into Canada, but first I have to complete a form on the app ArriveCan. It asks the typical screening questions, but also wants to know where I'm going to quarantine. That's because the CBSA selects random people for COVID tests at the border. If you test positive, they want to know where you're staying.
The pandemic forced thousands of surgeries to be delayed in Alberta and Saskatchewan, with COVID-19 cases declining in both provinces. Some patients still haven't undergone vital procedures.
For Leah Crawford, a difficult fourth wave of COVID-19 led to 4 additional months of pain.
It's unimaginable because, I'm in enough pain as it is. I'm not having this hysterectomy just because, I'm having it for a reason.
The Calgary woman, one of thousands to have a surgery postponed, as Alberta struggled to cope with a surge in COVID patients that nearly brought the health system to its knees. With that surge now subsiding, doctors are once again in the OR, though the system is nowhere near back to full capacity. Dr. Oliver Baith treats GI, liver, and pancreatic cancer patients with often aggressive tumors that may have seen their disease spread during the delay. Alberta Health Services is now prioritizing pediatric and cancer patients, but the backlog for other surgeries may take longer to clear. Last week, the Saskatchewan Health Authority's CEO said it could be 18 months before that province is able to perform orthopedic surgeries again.
Manitoba's Chief Provincial Public Health Officer Dr. Brent Rawson said on Friday that new capacity restrictions will take effect Saturday in the Southern Health region due to insurgent COVID-19 cases.
So the additional restrictions that are being implemented today or are being announced today will be taking effect at midnight tomorrow. And so relates to the religious gatherings in Southern Health region. So the religious gatherings are limited to 25 persons unless the facility can physically divide their space into separate areas, in which case you can have several cohorts of 25 individuals. The total number of attendees at a service may not exceed 25% capacity of the facility to a maximum of 250 people. Again, that can only be achieved through the use of cohorts if the overall capacity allows. So those cohorts must be separate. They must not mingle in any way. They must have masks on at all times, and distancing rules apply. So this one, again, applies only in Southern Health Sainte-Sud region. The previously announced municipalities that are in that capital region, again, are not going to be treated as part of the Southern Health region as for these orders. So Cartier, Headingley, McDonald, Richat, Niverville, St. Francis, Xavier, and Taché will be treated as the capital region as per the most recent orders. So this goes into effect Saturday, November 13th, 12:01 a.m. And so again, services that are restricted to fully immunized individuals, and including those under 12 who are not eligible for vaccine, they can still be held without capacity limits in Southern Health. Services that will not require proof of vaccine will have to abide by these new capacity restrictions starting tomorrow midnight.
Dr. Neely Kaplan-Smith never thought this would be part of the story that is the COVID-19 pandemic in Canada.
From banging pots and pans on front porches to holding parades outside hospitals, Canadians were creative in expressing gratitude and support for healthcare workers fighting COVID-19. But for some, the love has turned to hate. Once hailed as healthcare heroes, a number of them now report becoming targets for hate. Ottawa Dr. Neely Kaplan-Smith, who has organized large outdoor vaccination events, is now afraid to walk outside alone. The College of Physicians and Surgeons of Ontario says significant changes in public health policy often result in physicians and CPSO staff being subjected to abusive and intimidating behaviors by members of the public.
Prominent COVID-19 anti-vaccine activist Robert F. Kennedy Jr. on Saturday joined Italians protesting at the Green Pass as Italy reported 53 coronavirus deaths and 8,544 new.
All of these rights that were taken away from us, these governments said it was temporary, it was only 2 weeks, it would be over. In truth, you can all see what's happening. They are taking those rights and they will never give them back unless we make them. The Green Pass is how they consolidate their power over your lives. And I can tell you this, I will stand side by side with you, and that if I have to die for this, I'm going to die with my boots on. It's clearly an instrument for controlling money supply, controlling individual movements, controlling our kind of new digitalized economy that gives these totalitarian elements the capacity to control every aspect, every feature of our lives. And the Green Pass is the emblem of that. I came to Italy. I've been meaning to come to Italy for a long time because I think the resistance here is most organized. It's building. People are angry because they see what's happening, and I wanted to give them support.
In the US, 47 million Americans have been infected with the virus. That's nearly 15% of the total population.
Month after month, new cases of COVID-19 continue to surge across America, jumping from 33 million to more than 47 million in the past 6 months.
It's really hard right now.
Hospitals in a handful of states are overwhelmed again with COVID-19 patients. Minnesota is now seeing its 4th deadly wave. Hospitals in Colorado are swamped too. 95% of ICU beds are filled, more than at any other time during the pandemic. Medical workers fear what's coming next with the holidays and flu season about to hit. Colorado's governor is so concerned, he's issued an executive order allowing all adult residents to get COVID-19 boosters, following similar orders in California and New Mexico. The governor jumped ahead of federal guidelines, which limit boosters to adults 65 and older or people with underlying risk factors.
Please, if you got the vaccine 6 months or more ago, get your booster. It's a really important part of protecting yourself. It's a really important part of ending the pandemic in Colorado.
The surge in hospitalizations comes as some workers in large corporations fight vaccine mandates. A federal court in Texas just sided with United Airlines after it placed 2,000 employees on unpaid leave after they were given medical or religious vaccine exemptions. But the workers plan to appeal. 20 months into this pandemic, Americans are still at war. Tens of millions of federal workers and large corporation employees face late November and early January deadlines to get vaccinated. Many remain defiant against getting the shot, while weary doctors and nurses battle to keep unvaccinated patients alive.